finally doing buccal fat removal. I have been thinking about this ever since the minute it was introduced to me years ago, and I tried everything and anything to help avoid the surgery, including a Botox masseter reduction, which has helped my face shape so much. I also did Kybella in my jowls, which also reduced the lower face. But after doing a consultation with a couple surgeons, they basically said that my jowl fat compartment, or the buccal fat area, is just a lot of tissue. So they recommended surgically excising this area, and you could see it has like a nice defined border when I smile, and that is really my biggest insecurity, is when I smile, my face gets so full. I have no filler in my face in terms of the cheeks or the lower area where it looks nice and full. I think so many people think I look overfilled all the time, which is really sad because this is an area that I'm already self-conscious over. But I'm pumped for this because I did a couple other surgical procedures that I've been really happy with on my face, like my nose and my lip lift. So I think this will be the thing that really helps complete my overall face shape. So follow me along. I chose Dr. Jonathan Zelken. He is located here in Newport Beach. I went to a couple consults in Beverly Hills, and I was gonna go as far as going to New York and Florida for another surgeon, but I felt really confident with this surgeon because he just knew exactly where to go when just doing my entire assessment, and he really gave me that reassurance that this is going to be the best option in terms of having a great face shape. So I am on my way with my supportive hubby, who actually doesn't think I need anything at all, of course, and I love him for that, but I think this has been something I've been struggling with for so long. So without further ado, my money, my body, let's do this.
No. Our objective is going to bring all of this in. Is to bring all of this in today a little bit.
So full.
Yeah.
Okay. I'm down.
Right.
So down.
So this takes a little bit of time to kick in.
Okay.
Once it kicks in, I'll be back.
I'm excited. Cheeks. Oh my god. Bye. 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 Cheeky, cheeky. You gonna miss one?
Yeah, I'm gonna miss some.
Aww.
I just took your breath away. See all that smell?
Mm-hmm.
All right. What's that?
Can you get more light? That's a big old fat pad, babe.
It's huge. We're so close to having that. I just wanted to cut it out. But comfort comes first.
Yeah.
Well,
You gotta name it.
get back in. All right. One side done, one side to go. Okay.
Good job. I'm so excited.
I think whatever it is what it is.
Yeah.
I don't intentionally try to take out more. Whatever comes out, comes out.
Okay, I'm so happy. Are you happy?
Yeah, I'm very happy. Other than this is gone
There's
too.
just one spot
This
that
is
was
gone
like
too.
a little, oh my god.
It's totally gone. You can't tell. You can't tell.
Yeah, I
I
can.
injected 6 cc's and I took out 4.
She snatched.
Yeah. So these are the buccal fat pads. This came out of the right side. This came out of the left side. And this is the buccal belly. This is the biggest part of the buccal fat pad. There are extensions. This is actually upside down. There are extensions that go into the temple and down to the neck. But really, this is kind of exactly what it looks like if you were to look at a textbook drawing of a buccal fat pad. This one upside down. A little bit of scar tissue on them. They're a little bit yellow or a little bit whitish colored, I think, because there's some surrounding scar tissue. But it's not bad. This is a beautiful specimen of buccal fat. We're going to send it to the restaurant for deep frying right now.
Yeah. Wow, I'm really excited.
How do you
This is
feel?
good.
It came out
This
really
is
easy, and I
good.
actually already see improvement in the contour. I don't see that step off that we saw before
That's what I'm
surgery.
saying. It
I
looked
know.
good.
I know. I think you're gonna be super happy with this decision. You're so welcome.
That's so gross.
Whatever. This is my tissue. This is so cool.
If you eat it like a placenta, I'm gonna have to disassemble it.
Okay. Yeah. Should I do it?
No,
Did you do it?
absolutely not.
I think the Percocet has hit.
No, I'm
Don't do
really
it.
into this stuff.
I'm pulling it off.
Okay.
We're cutting it off.
I'm cutting it off. Oh, goodbye.
Name
You had
it.
them all your life in that cute picture when you were a kid.
I know.
Someone
Goodbye,
every single
Chester.
video.
Me and Dad would always be like, oh, so good.
Chester and what's the other one's name?
Nut. Chester Nut. I don't know.
What?
I have nuts in my cheeks. Like a chipmunk. I don't know. Chester this. I don't know. The squirrel.
So you did.
All right, guys. I'm done with my buccal fat removal. The entire procedure literally took about 20 minutes. It was basically painless. There's one spot that was a little bit spicy, but he gave me more lidocaine and it totally subsided. And I'm really happy. I got the full buccal fat out and I cannot wait to see how it looks like. He said the swelling is going to be about 1 or 2 weeks and then I'll start to see the results at the 1 to 3 month mark. So I am going to be patient and just heal, and I'll keep you guys posted. All right, it's 7 p.m. and it's been a total of about 2.5 hours since the procedure ended, and you could see a little bit more swelling is settling in. I took off my little jaw bra strap is what the surgeon called it, just so I can eat, and he said that I could literally eat solid foods. He did say soft and liquid foods would be easier maybe tonight, but I was able to eat salmon, spinach, no problem. And I really have no discomfort talking. I just have a couple sutures on each side of inside my mouth. After every meal, I was instructed to use this chlorhexidine rinse, and it's recommended 3 times a day, just 15 milliliters, which is the capacity of this, or half the capacity of this cap here. I also have some pain meds like Percocet for some pain, but I'm not in that much pain, honestly. I think extra strength Tylenol will take off the edge. And then I have some antibiotics and Zofran if I feel nauseous, but I have not felt that at all. So just wanted to update you that I'm able to eat and talk comfortably. I am going to continue to wear this little jaw strap with some ice tonight. And then I am so happy I have a bed that inclines, so I'm going to sleep with my head elevated for the next few nights, or maybe a whole week if my husband can tolerate that. And I am really happy with how I feel post-operatively. Okay, this is me the day after buccal fat removal, and I don't feel like I look swollen at all. They did tell me that the next day would be the worst swelling, but then again, I did sleep with my little compression wrap around my head, and then I did ice on and off about twice the last night before sleeping. I did end up taking a Percocet for a little bit of the pain I felt like right up here near my cheek, but this morning I don't feel like I need any more pain medication, and if I do, I'll probably just opt for the extra strength Tylenol instead. And then I am continuing with my mouthwashes, and I just looked inside my incision, and it looked so I checked inside with my incisions. They look nice and clean and intact. And I really do think sleeping with my head elevated really did help throughout the night. I'm gonna kind of do that for the next 5 nights. Same with just kind of staying away from a low sodium diet so I don't puff up as much. But really happy. I literally look like I'm back to baseline. So I'm really excited to see how it progresses, and I can talk and eat comfortably. In fact, last night I had some salmon and spinach, and I had no difficulty chewing, swallowing, and it just was nice and clean after the mouthwash. So I'll keep you guys posted. Okay guys, I think this looks a lot worse than it actually is, but I'm getting ready for bed, and I wanted to show you what this compression garment looks like. But basically it's like this, kind of like, it reminds me of a headband, you know, with the Velcro, and then it has like another small piece of Velcro. I probably kind of did it sloppy, just so this doesn't like literally like slide forward. And I like it because it just feels nice and secure, especially for sleeping. Inside here, I have little ice packs that are reusable, and I froze them, but I coated it with the tissue paper, or I guess napkins, so I don't get like an ice burn, because I guess it's still a little bit numb in the area. But today I worked just fine. I was able to talk to patients, and it was nice and comfortable. I didn't need any other like pain medication. I think I just feel a little sore from like a full day of talking, and I just had dinner, so I decided to do some compression, some icing, and now I am elevating on my, like, I always call it a hospital bed, but feeling pretty comfortable, and I'm hoping that my swelling will be better tomorrow, although I already know that I ate some salty cheese tonight, so hopefully that won't influence the swelling too much, but I will keep you updated. This is me on day 3 of my buccal fat removal. As you can see, I'm much more swollen today, which the nurse did tell me that for her buccal fat removal, day 3 was the worst as well. I did my best to avoid, sodium containing foods that makes it swell even more, but I think just by the nature of my job, I talk and smile a lot, so by the end of the day, it does look a little more swollen and it feels a little more sore, but nothing that would require me to take any like Advil or Tylenol, for example. But I'm gonna do my compression wrap again tonight, because I do think that there is some level of reduced swelling with compression, and then of course with elevation of my head. But I am just really continuing my little mouth washes throughout the day and checking my incision inside my mouth just to make sure everything feels intact. The sutures don't feel bothersome at all. Let me see if I can, I can't really see, but they feel fine, they're absorbable, and they don't get in the way of eating. I just have to eat a little bit slower, take smaller bites, and it's totally doable.
Still have a little bit of this, so I think some of it is soft tissue thickening, to be honest. Just from like the injections in the past. Is that possible? Have you massaged it at all?
No.
Okay.
No massaging.
If I just worked it out right now, that was perfect.
Okay.
Hey,
Yeah.
I like it. Yeah.
Thank you.
It was a good call.
Yeah, I know. I'm happy I did it. Like, this is
I'm glad you didn't take your sage advice and say no, I shouldn't do that.
I know. I feel so like happy and like slim and just like, and even when I smile, remember I kept telling you like I was so concerned when I was smiling because of all the bunching. Like I feel like less puffed, like full. Does that make sense?
Oh yeah.
Yeah, because there's not like this like tubular structure. I just had my follow-up appointment with Dr. Zelken. This is my 1-week post-op appointment, and he's really happy with the results, as am I. But as you can see, I'm still a little bit swollen down here, but I can see some contour, and I'm really, really excited about this. He said it's not dimpling, it's just like swelling, like where he put the sutures, and I still can definitely feel the incision healing, and like it has this like bunchy feel. So he said all that's gonna flatten out, which I'm really happy to hear. And it's been such a comfortable like recovery. As you know, I stopped posting my follow-up with you guys after post-op day 3, just because I felt like it was progressively getting better and better in terms of the swelling. I only did compression for about 3 nights, on and off icing for the first 24 hours, even though I could have done it for the first 48 hours. And then no need for steroids. I didn't end up taking the antibiotics. He said my incisions look great, and the dissolvable sutures are still in my mouth, and he will, they'll just like, fall out or dissolve on their own. So I can't wait to see the final results. I'm still so happy with the outcome in terms of like just doing it. And this literally looks like me if I was like super, super skinny, like at my wedding, for example. And this is me on like my heaviest that I've ever been, but it's okay. We're going through a lot of stress lately, so yay.